Hello, if you're watching this on Instagram, thanks for being here. Pop down there. Go hit that little button down there. It sends you straight to IGTV. You can see what we're talking about here today on my show called Jimmy Rants. JimmyRants.com is the website. If you want to engage live in the show, you got to go follow me. I'm over on Instagram. I'm at Living Low Carb Man, LIVINLOWCARBMAN. Once you are there, engage live. Just like all these wonderful people, they're coming in right now. Thank you guys for being here today on Jimmy Rants. We also simulcast over on my Facebook page. Thank you guys for being here today. We also simulcast on my live stream of my YouTube channel. So lots and lots of people here in the family of Jimmy Rants. So thank you all for being here today. If you missed the live here on Instagram, they do throw it up. It's a pretty cool new feature, you guys. When we're done doing Jimmy Rants, they let me upload it directly to IGTV, like immediately. I type in some show notes and put it up on my page. And so as soon as this is over, it's up available for replay right away in high definition on IGTV. So be sure to watch it that way if you miss any of the lives. We also throw them up over at JimmyRants.com, and finally over on YouTube. Type in a keyword Jimmy Rants. You will find the show. And it's Tuesday, so we do also air some of the past episodes on the Living La Vida Low Carb Show. That is my flagship podcast, over 1,600 plus episodes and counting of that podcast. And so on Tuesdays, we air a special Jimmy Rants on the Living La Vida Low Carb Show to air some of that. Today, we've got a whole slew of recent Jimmy Rants I did about the meat shortages because of COVID-19. And so go listen to that one today on the Living La Vida Low Carb Show, LLVLC.com. Okay, you guys, it's time to get a little controversial. And sometimes people, they get their feathers ruffled a little bit because they don't want to hear controversy. They don't want to hear alternative viewpoints. But I am of the mindset that knowledge is power. And when you're empowered with knowledge that comes from an authoritative position, comes from a scientific frontline sort of position, you want to listen to those people. I don't think everybody that has an opinion, I've said this many times before, I don't think everybody that has an opinion about COVID-19 needs to be heard. They can speak all they want, they can shout it from the mountaintops all they want, and they're just a Joe Schmo that's just like sharing opinion based on a whole lot of nothing. Yeah, I don't have a lot of respect for that kind of position. Share your thoughts if you want, but don't expect anybody to heed it. But when you have medical professionals speaking out, sharing their thoughts as it relates to COVID-19 or any part of health, I think we need to be listening to them. And I've talked about it on previous Jimmy Rants. There's a lot of these doctors that are working right there on the front lines of COVID-19 saying, now wait a minute, some things don't smell right, and they're doing videos on YouTube and then they're getting censored on YouTube. So a lot of that kind of stuff is going on. But I think when a medical professional expresses some concerns that they're noticing and they offer up some things to back up what they're saying, that we have to listen to what they have to say. And one such medical professional right here in the keto community is Dr. Adam Nally. So those of you watching on the Instagram feed, I'm going to put a picture of Dr. Nally on the screen for you. So that is Dr. Adam Nally. He is a doctor of osteopath right there in Phoenix, Arizona. I have known Adam for many years. He and I have been really good friends. When I first started blogging, and then I started attending some of the obesity conferences, he was a young doctor at the time, just getting his feet wet in obesity medicine and what it all means. He was just learning about the ketogenic low-carb diet. And so he and I have gotten to be good friends over the years. He and I used to co-host my show called Keto Talk. It's now called Real Talk. I do it with Will Cole now. But back then, we first started with, Keto Talk with Jimmy Moore and the Doc. Well, Dr. Nally was the Doc. And then a couple of years ago, he and I put out this book called The Keto Cure, all about a low-carb, high-fat diet to so many of the common health ailments that people are dealing with. So this is somebody I'm abundantly aware of, his nutritional health philosophy, and personally as an individual. And I know that since the beginning of this COVID-19 all went down, he has been concerned about a lot of things regarding this. And if you follow him, he is Doc Muscles here on Instagram. He's over here on Facebook. He's got a Facebook page. Look him up. I put the link in there for Adam Nally. Just look up his name and you'll be able to see what he's been writing on his page. But today, I want to read from a post from his blog. His blog is at docmuscles.com, DOCMUSCLES.com, where he makes the argument why we no longer need to be worried about COVID-19. Now, this is going to be controversial, so I'm going to warn you ahead of time. By me bringing this to you, don't assume that I necessarily agree with everything Adam says in his blog post. I think information is powerful, and when you have knowledge, then you can make good decisions based on that knowledge that you have. So let's hear what Adam has to say, and then base your feedback on that after you hear what he has to say. So you guys ready? It's going to be a little bit rocky, but here we go. 5 months after the largest variant of the 5 coronavirus subtypes appeared with its ugly little glycoprotein envelope and infective RNA fusion peptide coating, many states and countries are still in quarantine or lockdown. Initially, because of the rapid infection rate that was seen in Italy and China, health experts recommended quarantine of the general population as a means for keeping hospital systems and medical providers from being overwhelmed. However, the overwhelm has been quite underwhelming. This begs the question for 4 very important questions that we need to be asking at this point. Number 1, should we still be quarantined? Number 2, should we still be wearing a mask when we go out in public? Number 3, should businesses still be shut down? And number 4, should we all be waiting on a vaccine? This is the first time in history that a large-scale quarantine of the healthy all across the country has ever been used. The sole purpose was to control the number of severe cases that would require intensive care and ventilator use. Multiple mathematical models predicted that hundreds of thousands would be dying here in America based upon the statistics out of Italy and China. If you're just joining us, I am reading from a blog post by Dr. Adam Nally. He's one of the ketogenic doctors here in the keto community. And he's making the argument that we don't need to be worried as much about COVID-19 anymore. And it's time that we end the quarantine, we end the mask wearing, and we open back up businesses. So let me continue. In early February 2020, we were concerned that risk of death as high as 5.5% was in the initial data out of Italy and China. Limited N95 masks and protective equipment was available. In agreement with the CDC and the WHO, I recommended that everyone wear a mask, take drastic infection precautions, and quarantine as a means for preventing the risk of transmission. So that was his initial reaction, Dr. Nally, when all this started to go down. Because viruses like COVID-19 and influenza are so small, a single layer cloth mask has only been shown to decrease your risk of viral infection by about 1 to 2%. Triple layer cloth masks with central interfacing layer gave up a 20% reduction of infection risk based on the studies we have in the literature. At the time, any protection was better than no protection. So when this all went down, Dr. Nally was fully on board with doing all the things, the social distancing, the wearing the mask, and the quarantining, all the rest. But he makes the argument that this has all been very underwhelming. As this virus crossed our shores, traveled all across the amber waves of grain, and ascended to the majestic purple mountains of majesty, the overwhelming number of patients hitting the hospital in droves isn't quite what we saw. A few areas such as New York City and Washington State were hit very hard, but not nearly as hard as they predicted. The only reason that we quarantine an entire population was a means of decreasing the load on hospitals and medical providers. Ever since the coronavirus entered the U.S., 2% of those who actually get infected have required hospitalization. our fears never actually came to fruition. The hospitalization load never even reached full capacity in 99% of the hospital facilities across the country. Many of the facilities began furloughing employees last month. Some claim that this is because we quarantined the healthy, yet if this were the case, infections would begin to rise as soon as all the lockdowns were lifted. Yet, so far, there's been no surge coming in the last 3 to 4 weeks, not even a blip. And even in Sweden, who only quarantined the sick and the elderly at high risk, has not seen the overwhelming surge of death that so many people had predicted. So then Dr. Nally shifts to why we are quarantining healthy people. In all of history, we've never seen any benefit that comes from quarantining healthy people. In fact, quarantine of the healthy has been demonstrated to be unhealthy when you have a well population. Based on scientific evidence we have today, despite what our politicians say, there's no reason that we should be quarantining anybody that is not ill. Seeing all of this data over the last 2 weeks dramatically changed my perspective on this virus. Well, the only concern with that position that Dr. Nally has taken is COVID-19 very specifically infects a lot of people that are asymptomatic. And so if you're asymptomatic, you think you're well, you think you're healthy, but actually you're carrying the virus, which then can be passed on to other people. So this is kind of the uniqueness that COVID-19 does present. So it's interesting he makes that point of, well, if you're not ill, you should not be quarantined, when we know that the reason why people are being quarantined, even so-called healthy people, is to protect those people that are vulnerable that you may come into contact with. This is how the nursing homes have had huge outbreaks. People come, are asymptomatic, but they bring it in and they transmit it, and then these metabolically unhealthy people tend to get it and suffer the worst consequences. So I slightly disagree with that point, because he's not taking into account that this isn't just about the individual and their symptom, but it's also about, could they be carrying it? So far, that's the major point of dissension that I have with what he's writing here. So risk factor for disease severity, there are 3 different maladies: hypertension, which is high blood pressure, diabetes, and coronary artery disease. These are all the 3 most common medical problems that I've seen in my clinic over the years. Remember, he is a practicing osteopath who sees patients on a daily basis, trying to help them with a ketogenic diet. That's what affects 85% of the people in my practice. All of these are driven by hyperinsulinemia and insulin resistance. Hyperinsulinemia is defined as an elevated insulin production that is 2 to 30 times normal when you ingest any kind of carbohydrate or starch. It starts 15 to 20 years before the onset of type 2 diabetes and is the cause of hypoglycemia, as well as elevated fasting blood sugar, prediabetes, metabolic syndrome, chronic kidney disease, idiopathic neuropathy, hypertension, and coronary artery disease. Again, we've talked about this before on Jimmy Rants. All of those things are a part of the exact same disease process called insulin resistance. Elevated insulin, even in small elevations, puts a load on the immune system, and the higher your insulin response to starches or sugars, the more likely you are to have hypertension, diabetes, and heart disease. We found that those who have elevated insulin levels and those who are over the age of 45 with a stressed immune system are the ones that are most susceptible to getting the most severe infection as a result of getting COVID-19. We also know that those who do get severely ill are those over 45 with immune system compromise, which includes hyperinsulinemia. A very interesting fact that was published in The Lancet. This was a recent study. In that study, the authors found that the highest rates of death occurred in those who had current hypertension, current type 2 diabetes, and/or current coronary artery disease, heart disease, atherosclerosis. So this is that comorbidities that you've heard me talk about in quite a few Jimmy Rants recently. And so the comorbidities certainly make this advance a little faster. So interestingly, in Italy, Spain, and Portugal, they have the highest incidence of metabolic syndrome, hyperinsulinemia, all across Europe. it stands to reason that they have also been hit the hardest with a virus that is focused on this form of immunocompromise. So I know in Italy they always talk about that they're an older population as well, and that helped to contribute to why it hit them so hard. Older meaning more susceptible to having metabolic disease and things going on with a comorbidity. So the coronavirus is quite common, Dr. Nally continues. It's traditionally the very cause of the common cold. In fact, 2% of the population are asymptomatic carriers of 6 very different coronavirus strains that are all known to infect human beings. And this class of virus is responsible for 10% of all respiratory infections yearly all around the world. So he asks the question, should we be in quarantine still? He answers it by saying no. What we should be focused on is limiting exposure to those who are at the greatest risk. So who does he think has the greatest risk? Nursing homes? What did I read a statistic the other day? 1/3 of all the deaths from COVID-19 are a result of nursing home deaths. Care centers, I guess that's general health care centers. Populations of elderly, so wherever there are elderly people, which again, we talked about that earlier, elderly, more likely to have comorbidities, more likely to have metabolic disease and insulin resistance, as well as anyone known to have a suppressed immunity. Our focus, efforts, and funds should be spent keeping those populations from being exposed. So if we're going to quarantine any group, it's going to be nursing homes, care centers, elderly, and those with a suppressed immunity. How about mask wearing? Dr. Nally has very clear thoughts on this one as well. As we noted above, cloth masks provide only very minimal protection from bacteria and almost no protection from viral infections, 1 to 2% with a singular mask covering. He said even if you did a triple covering, it still only protects you with a 20% rate, which means you're 80% possibly exposed. Because we now know that the virus is similar to the influenza in terms of the risk of death, a generally healthy population should have no need to wear any masks. Wearing of a mask actually increases the likelihood of infection by increased frequency of touching your face. It was so funny, I saw a meme yesterday where they had Dr. Anthony Fauci, the big coronavirus task force leader, and he was wearing a mask at one of these recent conferences, and they showed every time he touched his face, moving the mask, and they showed him touching his mask, and they're like, that's literally how you spread the disease, is you grab the outside of the mask, even if you're just adjusting it, but if you touch any part of the outside of the mask, and then it ends up in your eye, nose, mouth, whatever, to get into your body, you've been exposed. So it is kind of interesting. It also perpetuates a climate of risk, fear, and implies that if required will be covered cost of medical provision at the state and federal level. And so, so Dr. Nally has the meme with Dr. Fauci touching his mask. So there's where Dr. Fauci is literally touching all over his mask at a recent press conference. You can see where he's picking his nose in one of them, scratching his ear. Yeah, he's doing all kind of stuff. The mask wearing thing, it's just fascinating to me when I have been out and about watching people wear the mask. I think the other kind of thing with wearing the mask, which if you want to wear a mask and you feel safer that way, that's great. But when I've been out and about, I think it makes people feel overly confident that they're protected. And I don't think they realize the risks that come with wearing the mask and even like protecting other people from you. I don't think they're honoring that physical distancing that you should be doing and some of the other things. So I think wearing the mask might have somewhat of a counterproductive result. So in a way, I'm sort of agreeing with what he's saying, because we don't really have kind of a standardization of what it's actually doing and what the purpose is and how to do it properly. See, this is the problem. When COVID-19 hit, this was so new, we all immediately had to become immunologists. Like, did you kind of have to have the immunology 101? Like, here's what you do in case of. It's almost like we had the masks behind a little piece of glass, and we took the hammer to break the glass and pulled the mask out, and then we're like, now what? What do we do with this? So yeah, it's an interesting argument right now. If you just joined us, I am reading from an article from my friend Dr. Adam Nally. He's one of the keto doctors out there in the keto community, so go check him out. He's at Doc Muscles here on Instagram. You can look him up, Adam Nally, here on Facebook. But he's calling for an end to the quarantine, an end to wearing masks, and we need to open up businesses again. And he's making the argument in his blog at docmuscles.com. So we're going to continue reading. There are a number of other medical problems, including an exacerbation of headache and migraines that occurs with the chronic use of a surgical as well as N95 mask. Those who have COPD, mask wearing can exacerbate hypercapnia, which is an increased carbon dioxide level causing slow respiration, confusion, and fatigue. Mask wearing can also have a causal factor in chronic hypoxia, which is a reduced oxygenation, which has been shown to increase the risk of your cancer to grow. In cases where patients have pulmonary fibrosis or impaired lung function, wearing masks for prolonged periods of time can lead to a loss of consciousness, and that's been documented. Therefore, I think wearing a mask for prolonged periods of time when it is not medically justified is not recommended, and in many cases can be dangerous to your health. Again, I think if someone wearing a mask feels comfortable and safe because that makes them feel that way, then I think it's okay if someone wants to do it, as long as they're aware that it does not give them this illusion that they are protected undeniably. That's what I see happening. And then this whole idea of if you don't wear a mask, you are just incredibly fearful. He is hitting on some really interesting parts of all this, that we're almost being shamed into wearing a mask when you go out in public. And that if you don't, you start to have those fears pop up. And he's saying, well, the fears seemingly are unfounded because we're finding the masks aren't doing as well a job as we might think they are doing. So again, I'm reading from what he's saying here and trying to give you more information to think about this. So what about the businesses being shut down? He has some thoughts on that. If the ultimate goal of quarantining us was to flatten the curve and protect hospitals from being overwhelmed, we were successful at doing that in mid-April, a full month ago. Some communities rightfully extended that quarantine to the end of April. However, there has been no justifiable evidence to suggest that healthy people can't now go back to work, feed their families, pay their mortgages, and provide for themselves. Multiple states, including Wisconsin, Kansas, and Michigan, have federal courts already overturning these quarantine measures enacted by overreaching emergency gubernatorial orders. So he's making the argument of, if we're generally healthy, then why should we not get back to business as usual when it comes to people reopening their businesses? Again, that's his thoughts. As for testing, how accurate are they? The accuracy and predictive values of SARS-CoV-2 tests have not been systematically evaluated. The sensitivity of testing likely depends on the precise RT-PCR assay, the type of specimen that's obtained, the quality of the specimen obtained, and then the duration of illness at the time of testing. He notes a study of 51 hospitalized patients in China who had this test conducted, which was a throat swab. 15 of them, which was 29%, had a negative initial test and only were diagnosed when they started doing serial testing. A similar study of 70 patients out of Singapore used the nose, where they basically shoved the swab down the nose and down the throat. It was negative in 8 of the patients. In both studies, rare patients were repeatedly negative, only tested positive after they conducted 4+ tests. This is a problem, and I talked about this on a previous Jimmy Rants, that because of the painful nature of shoving that swab down the nose, down the throat, not everybody goes down deep enough to get an accurate swab. So when they pull it out, it comes back negative. Oh, I don't have COVID-19, when they may actually have it. I think they said the fail rate was 30%. So it's significant, the amount of people that don't get a good test result. 7 studies, including 2 unpublished reports that evaluated RT-PCR performance. The estimated rates of these false negative results were 100% on the day of exposure, 38% on day 5, 20% at day 8, and 66% by day 21. And even though the manufacturers are pushing the antibody testing with IgG and IgM frequently showing a false positive as well, and they've been shown to be erroneous 20 to 30% of the time, according to Dr. Nally, the accuracy and time to antibody detection vary with the particular test used. Studies evaluating the specificity of serologic tests in a broad population are currently lacking, and in particular, the rate of cross-reactivity with other coronaviruses is a potential concern, and IgM tests are prone to false positives. So that's interesting. That's the first time I've ever heard that when you get one of these antibody tests, that yes, it's supposed to detect COVID-19, but what if it detects one of the other coronaviruses, and it might show that you have antibodies for one of the other ones, but not for COVID-19? That's an interesting wrinkle I had not thought about. In the first week since symptom onset, fewer than 40% had any detectable antibodies. By day 15, IgM and IgG were detectable in about 94 and 80% respectively in the various studies that he's looked at. In the United States, several serologic tests have been granted emergency use authorization by the FDA for use by laboratories certified to perform moderate and high complexity tests. The FDA highlights that serologic tests should not be used as the only test as a means of diagnosing or excluding active SARS-CoV-2 infection. The sensitivity and specificity of many of these serologic tests are uncertain. Yeah, when the FDA said, yeah, have at it, we need more testing, they pretty much opened up the floodgates for inaccuracies. And I know I talked to Dr. John Lemansky, which, by the way, tomorrow on the Live and La Vida Low Carb Show Wednesday episode, llvlc.com, I have a full hour conversation. Actually, I think we went about 75 minutes. John and I had a discussion last week. He's working on the front lines with 7 different hospitals right now with patients with COVID-19, had some really interesting insights to share. And one of the insights was that a lot of this testing is so bogus right now that we really need a 95% sensitivity. And most of these tests do not have anywhere close to that 95%. So that test that I had run, the antibody test recently, was a 95%. I did consult with John before I went there. But those tests are few and far between and definitely not available widely. All right. So, Dr. Nally asked the question, should we all be waiting for a vaccine? So as a preface to this section, please be aware I'm a very strong proponent of safe and effective vaccines because the RNA vaccines are so new. Long-term efficacy, safety, and adverse reaction studies should be essential before these are recommended across the board. It can take at least 4 to 5 years to 1, bring a vaccine to the market, and 2, complete all the adequate safety studies. And yet they're trying to get it out by the end of this year, maybe early next year. And I just saw a very famous lawyer, Alan Dershowitz. You might remember him from the O.J. Simpson trial. And I'm going to post it on my Instagram stories later. But he made the argument that from a legal perspective, they could require mandatory vaccination. So if they don't go through this process that Dr. Nally's talking about, 4 to 5 years, and they mandate that you take this vaccination, now there's going to be a fight on their hand if they try to like force people down and shove it into their arm. There are going to be a lot of people fighting that one, but it's not something to be rushed. So that's what he's saying. Should we be waiting for that period? So let's start by looking at the effectiveness of current RNA viral vaccines. The most common one currently used is for the influenza. It's called quadrivalent, and it has 4 different flu strains in it, and a high dose has 5 flu strains in it. Over the last 20 years, the percentage of seniors who get the flu shot increased sharply from 15% to 65%. It stands to reason that flu deaths among the elderly should have taken a dramatic dip as a result of this increase in the flu vaccinations each year. Instead, influenza deaths among the elderly actually have gone up. It was hard to believe, so researchers at the NIH set out to do a study adjusting for all kinds of factors that could have masked the true benefits of the shots, but no matter how they crunched the numbers, they got the same result. Flu shots had not reduced death among the elderly. It's not what health officials had hoped. I was shocked when I read about these studies demonstrating that yearly flu vaccine for those over 65 does nothing to actually reduce their chance of dying. These studies funded by the government in 2005 and 2006 were suppressed, and you've never heard about them. Yet the CDC still emphasizes to the elderly to go get your flu shot. One reason that these vaccines are ineffective is that viruses like influenza and coronavirus are highly antigenic. What that means is they are hundreds of strains and the virus constantly is changing rapidly. Influenza has over 600 strains alone. The current high-dose vaccine only covers 5 of those 600 strains. SARS-CoV-2, which is COVID-19, is known to have over 160 strains. There are too many rapid mutations to neatly trace a COVID-19 family tree. According to Peter Forster, a geneticist at the University of Cambridge, we used a mathematical network algorithm to visualize all the plausible trees at the same time. His research identified 160 genomes within the hundreds of additional variants of the 3 central COVID-19 strain variants. The other very fascinating concern is that the use of an RNA virus has the potential to increase susceptibility to other viruses. In a Department of Defense study looking at 6,000 military personnel vaccinated in 2017-2018, those who got the influenza vaccine demonstrated an increased susceptibility to coronaviruses by as much as 36%. Non-influenza virus susceptibility went up by 15%, and a human metapneumonia virus susceptibility went up by 59%. So they took this vaccine for influenza, and it made them much more susceptible to other forms of coronaviruses, which I thought was really interesting. A second influenza study demonstrated an increased risk of para-influenza virus in adults by 4.6% increase in vaccinated adults, 2.6% increase of unvaccinated adults. Though the researchers dismissed it as a calculation error, the p-value reflects that the vaccine played the same role, or some role, in that increased susceptibility. So what about herd immunity? This is something Dr. Nally had some thoughts about as well that I think you'll find interesting. Do the math on a vaccine that covers only 4 out of the 600 strains, like the quadrivalent influenza vaccine. For a vaccine to create some kind of a herd immunity, currently being touted across the airwaves as the way for us to all return to normal, it would require the average human being to be vaccinated every single year for 100 years. Then it would take 200 to 400 years after that to create a semblance of herd immunity. And that's after 4 to 5 years of studying the safety of a vaccine over large populations. Influenza and HPV, the 2 most widely used RNA vaccines, still have a number of post-market adverse reactions, which includes Guillain-Barré syndrome, GBS, convulsions, febrile convulsions, myelitis, which includes encephalitis and transverse myelitis, facial palsy, which is Bell's palsy, optic neuritis, neuropathy, brachial neuritis, syncope, which happens shortly after vaccination, dizziness, and paresthesia. Though these adverse events will occur more rarely, it is essential that you know that these are the risks that come from these newer RNA vaccinations. So, in conclusion, and then I want to see what you guys have to say here in a minute, our focus should be shifting to protecting the elderly and the immunocompromised. The evidence does not support any quarantine of the healthy. The evidence does not support any kind of general public mask wearing, and there's no evidence that continued business closure is beneficial. So what can we do? Reduce your risk of hyperinsulinemia is number one. And we've talked about that a bit. Some of the risk factors, the comorbidities, the things that people who are susceptible to the most severe symptoms, they need to get their metabolic health in order because we're seeing some kind of a correlation with that. He, of course, being a ketogenic doctor, recommends a carbohydrate-restricted diet, along with exercise, controlling your blood sugar, controlling blood pressure, improving your cholesterol, and limiting risk factors that suppress your immune system. Quit smoking and quit vaping immediately. Actively engage your congressman. Ask what they're doing to protect seniors, nursing homes, and shut-ins. Let your governor or mayor hear your voice. Tell them about what the damage to your livelihood has happened as a result of this. Educate yourself about your civil liberties and don't take them under the guise of an emergency. Don't let anyone take them. And then finally, ensure all your loved ones, especially the elderly and immune suppressed, understand all the truths about their risk of infection. Don't be afraid to go outside and be a human again. Again, Dr. Adam Nally, docmuscles.com. The title of his blog post, Why You Shouldn't Worry About COVID-19 Any Longer. Again, if you joined us late, I am sharing this for information purposes. Please do not think all that I just read is necessarily what I believe. I'm reading it because I think it's interesting information from a medical professional who is saying some interesting ideas that I think everything needs to be on the table right now. We need to consider everything that's happening and take it all within the same context of what we're hearing from the official narrative, along with some of these alternative perspectives. The only thing I wish Dr. Nally had addressed that he did not address is social distancing, which I hate that phrase, social distancing. It's actually physical distancing. He didn't say anything about being 6 feet apart from other people. I know I'm still actively, when I'm out and about, not getting within 6 feet of people. Although at Sam's Club, all those people wearing those masks, but then they're like all on top of each other. I was literally standing in line to leave because they gotta like check your receipt on the way out the other day, and this person came right up behind me within like a foot. And I'm like, can you please back up? Like I was like 6 feet, 8 feet behind the person in front of me, and this guy comes right up behind me. I'm like, dude, you're killing me, man. So I assume by his omission of talking about it that he still thinks physical distancing from other people is probably still a good idea. How long do we hold to doing that? How long do we hold off on giving hugs? How long do we hold off on like touching people, even fist bumps or anything? How long do we do that? He didn't mention that anywhere in his article. I may have to reach out to him and say, dude, more. Maybe I invite him on the Live and La Vida Low Carb show to talk about what he wrote in here and then ask him some of these other questions that I have. But it's good to hear what some of these medical professionals are saying because they know from whence they speak. And of course, Dr. Nally had all the citations in his blog post at docmuscles.com. If you want to see any of those, just click on that and go read his article. All right, I'm gonna come over here to Instagram Live first, then over to Facebook Live, and finally over to YouTube Live. Thank you all for being here today. JimmyRants.com is the website. All right. I love listening and watching to Dr. Nally, says Linda. Thank you. Yeah, he was fun to do a podcast with, and obviously we wrote a book together. So Mrs. Marby says, I agree with you that masks seem to make the folks feel overly confident. I think many don't realize they're supposed to keep others safe if you are infected, not the other way around. Yeah, I think they have not done a good job of explaining the purpose of the masks. A lot of people think, oh, I'm wearing a mask because I don't want to breathe in and get COVID-19, even though your eyes are still exposed and you could still get droplets through your eyes, which is kind of funny. They should have done like mask and goggles, maybe. Maybe we should have had like little clear goggles walking around and mask and goggles. And yeah. But yeah, it's not about you per se, but about you spitting droplets at other people if you're infected and then you get someone who's immunocompromised or elderly or one of these comorbidities. Yeah, it is interesting. They've done a horrible job of explaining the purpose of the mask. They just said, wear a mask. and didn't really tell us anything about that. Tanya says, I agree with everything that he said. I think our businesses should open back up. I don't think wearing a mask out anymore is helpful unless the business requires it. Yeah, a lot of businesses are requiring it. I know Costco, as of Monday, were requiring anybody that wants to come in their store to wear one. I have not been to Costco since they require it. And full disclosure, I have yet to wear a mask when I go out, but I'm not out that much. I literally am at home. My normal day-to-day-ism of what I do in my job, I pretty much live on my property and do everything here. The only reason I go out is go get food and come back home. That's it. So I'm not really out that long, and I try to go in the off-peak hours so I'm not fighting a lot of people out there. So I do not wear a mask. When I am out, I don't get anywhere close to anybody. I don't even talk when I'm talking to, or when I'm in front of an employee. I don't even talk because I know those droplets can go out. If you haven't seen some of the laser images of when you talk, how much you spit, you don't realize all the spit that goes in the air. It would be cool if I got like a black light, turned off the lights and did a black light, and you could see all the little droplets in the air. It's Jimmy Rants, you would get showered if you saw all the spit in the air. Marley says, I'm mostly focused on trying to get healthy, so if I get it, I can survive it. Yes, same here. I think for me, I have been dosing on vitamin D at a very high level. I've been taking, ever since all this went down, somewhere around 25 to 30,000 IU of vitamin D. Not every single day, but I high dose that just to keep that up. And I'm doing a general multivitamin and some other things. Vitamin C, I have not been able to get into a higher dose just yet. It gives me too much gastric distress. So I'm trying to find a version of it that doesn't give me poopy pants. But yeah, I'm the same way. I've done all the things to try to stay healthy, and obviously staying keto has been helpful as well. I read Dr. Muscle's, or Doc Muscle's article yesterday, mostly agreed as well. It's a shame alternative opinions are so taboo right now. And yeah, not only taboo, censored. Like if he made a video that shared all of this information over on YouTube, YouTube would have already brought it down. And I love that he wrote this blog post on his website because they can't take it down off of there. It's up. And I wanted to give him an amplification here today to at least let people hear about this. Now, whether or not this video is going to stay up or not, I suppose we'll find out. But it is a shame that people that have medical knowledge and medical moxie and share the science that supports their position, why we're not hearing from them. Okay, maybe it's not something that's valid. Maybe it's not something that we pay attention to. But let's not squelch the voices that might have something to say. So I agree with you. I'm glad that he put this out here, but unfortunately, a lot of these kinds of voices like his are not being allowed to be heard, which is a shame. All right, thank you, Instagram Live. We're going to pop over here now to my Facebook page. We'll be back here in just a minute, Instagram. Hey guys, what's going on? Let's see what you guys have to see. What you guys have to say about this. I even fall over my tongue sometimes. It just happens. It is what it is. Lots of hellos. Hello, guys. Berkeley says, people spread the flu long before symptoms show up. COVID-19 is no different. Yeah, I think reminding ourselves that even though you're asymptomatic does not mean you're not spreading. And so I would love to ask that question of Adam. Okay, if someone's asymptomatic, let them back out, let them go to work, let them blah, blah, blah. But what about the people who are infected, but they're asymptomatic, and so they could spread the virus? Is he not concerned about that? That would be one of my first questions if I can get him on the Living La Vida Low Carb show. Berkeley says, I don't need the government to protect me from illness. I'm 69 years old. I can do all the measures that I deem necessary. Well, you're also a little more vigilant than most people at your age. Kudos to you for doing the things to keep yourself healthy, and I know you are doing those things. But not everybody at your age and older are, and they've lived their life and had some rough things happen in their health. and now they are they're sitting ducks. My mom is 70, and she has myasthenia gravis, which is an autoimmune condition. She actually got that because she got bit by a bug about 8 years ago, which gave her meningitis. The meningitis then morphed into this myasthenia gravis, where basically one whole side of her body just went numb, and it was almost like a stroke. And so now she's on very high doses of steroids and some other medications to deal with it. I put her on keto, and that certainly helped. I've got her using CBD oil, but she's very much in the category of someone who's at high risk for COVID-19. So I'm talking to her just about every other day, reassuring her, okay, just stay at home. Don't, if you need anything, call my sister. She lives there where she does. And yeah, so she's feeling confident and safe and just doing the right things to protect herself. Judy says, I agree with Dr. Nally. We have destroyed the economy because of models that have been grossly and consistently wrong. Protect ourselves that are most at risk, and the rest of us need to go back to work. And there is that concern that's been expressed, and he expressed it as well, that we based a lot of these recommendations of quarantine, for example, on models. And we found that the models have been really bad wrong, like grossly off wrong. And so if they've been that wrong, maybe it's time to reevaluate what the original recommendation was. And I do find it interesting, and my friend Allie Miller, who I shared a little clip of the other day here on Instagram, she said the original argument, and Dr. Nally repeated it in his article, of putting us in quarantine was to flatten the curve and not to overwhelm the hospitals. Okay, well, that happened in mid-April. And so why did they not open back up everybody to go back to work and businesses open back up and everything go back then, if it was to flatten the curve? So they didn't say we're trying to get rid of COVID-19 and wait until the vaccine comes. They said we want to flatten the curve. So I think that's what's got some people up in arms, including Dr. Nally, as to, okay, the original purpose was to flatten the curve. We did that. The hospitals are not overrun, except for New York City and some other areas where they got especially hit. We've done the job that we were supposed to do. So why aren't we open back up? Which thankfully a lot of the states are individually kind of taking this on. And, oh, well, we hadn't been hit that hard. I know South Carolina, where I live, they reopened a couple weeks ago. And of course, a lot of our state economy here in South Carolina is predicated on people going to Myrtle Beach and Charleston and some of the beaches. So they reopened the beaches, obviously with parameters in place to allow it to be as safe as possible. So yeah, this could be devastating if they continue to keep people quarantined when we've met the original intention, which was to flatten the curve. Mitzi says this disease has a 99% recovery rate. Yeah, I've put that out there before, Mitzi, and people just yell at you, oh my gosh, you must live in an area where it's not as hard hit as us. And usually it's people in New York State, and that's fine. If you live in New York State, yes, you got hit a little harder. If you live in Washington State, yes, you got hit a little harder. If you live in an area that has an elderly population, a lot of nursing homes, yes, those people have been hit hard. But you're right, most of the people that tend to get this have recovered. And when you throw out a statistic like 98 or 99% recover from this, people get mad because, well, you're forgetting about the 1%. No, we're not forgetting about the 1, but we're saying, look, we're quarantining 100% for the 1%, maybe 2%. And so if we're quarantining everybody to save the 1 to 2%, why don't we quarantine the 1 to 2% and then let the rest of us go back to work? That's kind of the argument that's being put out there. There's no easy answers. And part of the challenge of this too is some people are susceptible and don't know it. And so that's the challenge. And nobody wants to be the reason somebody goes back out and then gets this and does suffer consequences. Mitzi says, my health and my immune system is my responsibility. And that's true. Unfortunately, a lot of people don't even know anything about immune health. They don't know anything about metabolic health. One thing that's been fascinating as a health educator in the nutritional health space for so long is we now have a ripe field of people that are ready to hear the keto message unlike ever before. You know, we've always said, what's going to wake people up? How are we going to get people to understand the value that comes from nutritional ketosis? This is our moment to say, hey, look, you know, all these people that didn't do well with coronavirus, with COVID-19, it's because they had high insulin, like Dr. Nally mentioned, hyperinsulinemia. Immediately get that down. Get your blood pressure down, get your triglycerides down, improve metabolic health, and get all those things in order, then you are going to be stronger in case you do get COVID-19. And so you're right. It is our responsibility, Mitzi. I would never expect anyone to give up their business or ability to make a living. If I had an impaired immune system, I would take measures to protect myself. I remember Allie Miller made that point on her IGTV the other day, where she's saying, hey, look, you know, there's a lot of things we don't have cures for, and there's a lot of people that are susceptible to these things, and there's a lot of people that die every year from the flu and some other things every year, communicable diseases, viruses, and yet we still live our lives. And so what made COVID-19 so unique? Now, I get it, it's kind of a new strain, and people kind of freaked out about the unpredictability of it. I get all that, but it's not something new in terms of we live in a world where these things exist out there with the potential for harm. People are being harmed by all kinds of things every single day that we don't have a cure for. We don't have a vaccine for. So it was an interesting comment that she made. Kira says, let's all stay home forever until nothing bad ever happens again. Well, there are those people who think that. And of course, you can't discount other factors involved in all this. And I really hate to have a jaded position that, okay, it's more than just about public health. Could it have to do with politics? Could it have to do with other factors? I hate to even mention that, but you almost have to give it a little bit of lip service, because it's impossible not to think that there's people trying to take advantage of this situation for their own public, personal agenda and purposes. So, I don't know. That's the question. All right, let me pop over here to my YouTube channel. Thank you guys for being here today on Jimmy Rants. Whoa, look at all them comments. Venecia says, hello. And then they have a whole bunch of stuff in Spanish. Let's see, my old Spanish. I speak English, but I need to write in Spanish. I'm looking for videos on Alzheimer's disease. Thank you. Wow, I did that on the fly. That's pretty good. Yeah, Alzheimer's disease, you can find all kind of videos. Just look up Alzheimer's on YouTube. You should be able to find it. Kim Call says, I haven't been wearing a mask. I have a doctor's appointment and will be required to wear one there. I do notice people getting close and pulling their mask down to talk. Yeah, it just defeats the purposes. Have they mapped the RNA genome of COVID-19? I was told no, and that is why tests are useless. Have you heard? So Dr. Nally just mentioned that, Pat, that no, they have not, but that they've used some algorithms to estimate that there's 160 different ones, but they don't know for sure. They haven't actually looked at that. Shirley says, I had the same thing happen to me. I went into Target for the first time, where they require my company shipped to wear masks in the store. People were very uncomfortably close. Yeah, don't wear a mask thinking you're now Superman. I don't like people that close to me anyway. I had someone brush my shoulder. Well, yeah, when I've been in a grocery store, I'm always leery going next to an aisle, because somebody might be coming out of the aisle. And yeah, somebody almost ran into me the other day, and it was almost like the Black Plague in my head. Ah! Katie says, coronaviruses and most RNA viruses are so mutagenic that a vaccine will not really work. It's the reason the flu vaccine is so ineffective, the reason that we still don't have a cure for the common cold. That's true. Karen says, I think a lot of this stuff is political. It's unfortunate, but I agree with you. I do think there is an element of this that's being used politically. For what purpose, I don't know, but just don't put it past people to have an ulterior motive in keeping this going. Oh, Shirley likes my Spanish. It's been a long time since I took Spanish, but I was kind of reading it broken I think I did all right. Jill says, wish me luck, Jimmy. I'm leaving for an RV trip so I can get out of the Arizona heat. Yeah, I don't blame you. I've been in Arizona and it's no fun. It's what, during the summer, you guys get 120, 130 degrees. Rabbi says, do the case and mortality numbers show that population density causes worse outcomes, or do comorbidities contribute to it, or is it different state policies? Whatever it may be, we have to understand that this mass numbers only help the debate point versus counterpoint. In reality, we need to understand the difference between viral and human factors that predispose for probability of infection. If we continue with mass medicine mindset, we will just generate more data for debate without any real action of empowering the end user and reversing comorbidities that would help them become resilient and being able to fight infections and the latest bug of the day. Thank you, Ravi. By the way, Ravi will be on my podcast next week. Really fascinating interview I did with him recently that will air next Wednesday, so on the Live and La Vida Low Carb show. So thank you for that input, Ravi. Sarah says, my brother-in-law just passed on Saturday of COVID-19. He was in a home, 69 years old, compromised immunity, but nevertheless, it's real. Yeah, and I'm sorry for your loss. It's unfortunate that there are so many people who are immunocompromised, who do have these comorbidities and the other factors that Dr. Kemapali just talked about. So sorry about that happened, and I certainly hope that there is something that happens that changes this for people. All right, let me come back over here to my Instagram page, see what you guys have to say. I think I saw a few more come in. Miss Twiggy says, I think we need more robust testing and tracing before we can safely reopen, especially in those dense urban areas. If you can contain a smattering of cases, you can probably manage it better. I think Dr. Nally kind of outlined the testing challenge is we need not just testing, we need accurate testing. And until we can ensure the accuracy, it's going to be a little bit challenging to get that robustness that you're looking for. Kitty Caddick said we need a solid data to build any model on. So far, we have no solid data, no reliable tests, testing everybody, some specific virus data, but none of it is here yet. Susie says Australia has only 100 deaths. Yeah, and I've got a lot of friends in Australia. The interesting thing about Australia is, other than the densely populated cities like Sydney, Melbourne, Brisbane, Perth, Darwin, those are kind of the main kind of big cities. Most of it is rural and spread out. I've done 3 speaking tours over in Australia. And then the whole center of the nation isn't even populated by humans. It's a bunch of snakes in there is what it is. So, but that is interesting. 1% of millions of people is still a lot of deaths. You're right, it is. So it should definitely not be discounted. So, all right. So, guys, Dr. Nally gives you some things to think about. And again, don't shoot the messenger. All I'm doing here is sharing some interesting information from a very respected doctor here in the keto community. And definitely I'm going to try to reach out to Adam to see if he'd be willing to come on the Live and La Vida Low Carb show to talk about some of what he put in there, plus some of the unanswered questions and some of the things like you guys have brought up here today of your concerns about this. So thank you for watching today. That is this episode of Jimmy Rants. Thanks so much for watching. Go follow me over on Instagram. I'm at Livin' Low Carb Man, LIVINLOWCARBMAN. Once you are there, you can engage live. We also simulcast live over on my Facebook page as well as on my YouTube page. So thank you all for being here today on Jimmy Rants. If you missed the live, you can watch it on replay on IGTV. As soon as this is over, they give me the ability to put show notes in there and then post it right up on IGTV, so it's available right away. You can also watch it on replay at jimmyrants.com. And then finally over on YouTube, type in a keyword Jimmy Rants. You will find the show. We go Monday through Friday, 11 a.m. Eastern. Sometimes I throw in a 5 p.m. Eastern, Monday through Friday, and sometimes on the weekends. So thank you for watching here today. Hope this made you think just a little bit. And until next time, we'll see you then. Oh.